Welcome to StantonMD. I'm Dr. Ryan Stanton, and today we have a great show for you. We'll start off with one of the most used and yet often neglected parts of our body, the mouth. We spend some time with JusticeDental and learn the importance of preventive dental care and some of the tools they use to ensure your mouth is ready for its daily duties. We also will discuss the things you need to do at home between visits to keep those smiles pearly white. We'll then move up to the face just a little bit to discuss some eye health. Retina Associates may deal more with the deeper aspects of the eye, but they help us understand the integral nature of vision, eye health, common mistakes with the eye, and when you need to seek care. We'll also talk with a patient that heeded the warning of the eyes, which may have saved her vision. And finally, we have a special guest this morning. We all know that prescription pain addiction has become the drug abuse epidemic of our generation. In response, the CDC recently released opioid prescribing guidelines to help physicians manage pain, but also prevent addiction and misuse. We will talk with the director of the CDC, Dr. Frieden, to get more details about the recommendations and what they mean for pain management in the United States. It's a packed show, so let's get started with some great information about that smile and JusticeDental. Our teeth are a commodity that is often taken for granted. It is one of the very few tissues with exposure to the outside world that once in place don't regenerate or replace themselves over time other than once in childhood. Healthy teeth are integral to our lives, yet nearly all of us will have at least some problems during our lives. We may think that our teeth are only about food and smiles, but they are much, much more. You may think that brushing once or twice a day is plenty, but dental health takes some TLC. I got to spend some time with the fine staff and dentists at JusticeDental to see just how important it is to promote a healthy set of chompers.
It's because it's an entryway for bacteria. And so, we kind of forget about that it's an opening, into the rest of the bodies.
Dr. Justice notes that what she does at her office is much more than simple cleanings and hygiene.
One of the things that we love to focus on in that initial exam that you talked about, or an exam, is kind of covering not just, obviously our foundation or our bone or gingival health is vital. We want a good solid foundation. But also the structures of the teeth, we're kind of analyzing, do fillings need to be replaced? Are fillings leaky? We see a lot of those old silver fillings. They were placed without what we call a bond to the tooth. We do, crown work. We do a lot of tooth-colored crowns or onlays or different types of restorations like that if the tooth needs more strength. We find that we have to do root canals sometimes. We do those. We do a lot, but we also refer a lot to endodontists if they're challenging. And we also do implant dentistry if there's a missing tooth and we know that a tooth is kind of hopeless. We have a lot of alternatives now in dentistry to actually give you something back that looks just like a tooth by placing an implant.
As a patient, dental health is something that shouldn't wait for a problem. You need to be proactive and take the steps to take care of your teeth and prevent dental problems.
Well, the importance is to maintain your tissue, gum health, and bone health. And so the recommendations for someone who's healthy is to actually visit twice a year to maintain health. For people who actually do not have tissue health, the recommendation might be different. For example, if you've lost bone or have inflamed tissues and bleeding, we might put you on a tighter recall schedule just to come in or re-care because we need to maintain the gingival bone health and gum health. It's really a lot more complex than what we've in dentistry alluded to for people, so sometimes people feel like I only have to go twice a year to maintain oral health, when in fact it may be different than that. So really what we're trying to do in those exams or visits is to just evaluate the tissue health and bone health.
The minimum advised dental visits is twice a year, but that may not always cut it.
Sometimes train people to think that you come in for twice your cleanings and you're healthy.
Brandy Sparks is a hygienist at JusticeDental and is seeing Pam Ryan today. Pam is a longtime patient in the office, and Brandy helps us understand the keys to the biannual exam. What do you look for when you're doing the checking of the teeth here?
I'm checking for cavities. I'm checking for any little pits within the teeth, fracture lines, checking for older fillings that may be starting to leak and break down, just to make sure everything is intact. Now, where did you feel like you bent the wire? We take x-rays on a periodic level of either once a year for bite wing x-rays or full series every 3 years. And what we're doing is just checking things that we can't see with our eyes. So, we see a lot of things going on in the mouth, but sometimes things hide. Bacteria hide, and so we can't see that there's maybe a cavity going on or a crown or cavities in between your teeth. So it's very important to get regular x-rays to make sure that we're not missing something. The good thing about that, though, is we have digital x-rays here, so the radiation's very, very low. They even tell us we don't even have to use this lead apron. But for patient comfort, we do that. And so the radiation's very low compared to the benefit of what we're finding with the x-rays.
It is also important to get the input from the patient on any changes or concerns they've had since the last visit.
Well, patients are very in tune with their body, so the main thing that they will see if they're feeling any sensitivity, I wouldn't know that she was having sensitivity, so she can tell me that, and that may show us some underlying problem that we wouldn't be able to detect without the patient's intervention.
Past the general exam features that you may expect at any dentist, this office also utilizes a tool that helps screen for mouth cancers.
As you know, we always do an oral cancer screening every time we clean your teeth just to make sure we don't see any abnormalities in the tissues. Now we have a new light called Identify. It helps us to detect cellular changes with oral cancer. So most of the time the lesions we were finding were in stage 3 and stage 4. We actually saw a lesion present in the mouth. And this camera is allowing us to see things at the cellular level, to be able to catch things at stage 1, which is the very beginning when it's much more treatable in stage 1. Where stage 3 and stage 4, sometimes people are losing parts of their teeth, parts of their jaw, their tongue. So this is just one extra way for us to help be more preventative and to help diagnose oral cancer. So that's the screening I'm going to do first here before we start, okay?
Okay.
Whitney Newman is also a hygienist at Justice Dental, and today she is checking on longtime patient A.J. Ryan. She fills us in on the art and technique of brushing your teeth. It may seem obvious, but it's a simple fact that many of us are doing it wrong. In fact, you may not even have the right tool for the job.
The average adult really does only spend 30 seconds with a manual toothbrush. Not every toothbrush is the same, actually. The first and probably most important thing is to look for a soft bristled brush. They make toothbrushes with medium and hard bristles, but those are too aggressive to the enamel and the gum tissue, so you always want a soft bristled brush. The other thing is most time patients pick up manual toothbrushes because that's really what we've just grown up using. But all the latest research does show that electric toothbrushes remove a lot more of the bacterial plaque that builds up in the mouth. Electric toothbrushes remove a lot more of the bacterial plaque that builds up in the mouth.
The mouth is for much, much more than talking and eating. It is a vital part of our health that requires daily attention and regular evaluations by a qualified dentist. So maintaining that perfect smile takes a lot of work and regular visits here to your dentist. You want to make sure that you do everything you can do to maintain lifelong dental health. I'm Dr. Ryan Stanton for StantonMD. We'll have further information in the coming months about your mouth, dental care, and some of the options available for rebuilding that smile. Coming up, we will talk with Retina Associates of Kentucky about eye health, challenges faced by one patient, and the tools they are making care possible. That's coming up right after this.
Justice Dental provides world-class dentistry with a hand-picked team of doctors, hygienists, surgeons, and specialists that work together to create natural, beautiful, and healthy smiles. Realizing that oral health is key to overall health, Justice Dental provides everything from preventive dentistry to full mouth reconstruction, ensuring your smile will last a lifetime.
At Justice Dental, we want to do your smile justice.
As a board-certified emergency physician, Dr. Stanton is a proud member of the American College of Emergency Physicians, also known as ACEP. ACEP provides physician and evidence-based patient resources at its consumer website, emergencycare4u.org. That site has stories, fact sheets, and advice on a wide range of emergency topics. From visiting the ER to mom tips, you can find them on emergencycare4u.org. Now, back to the show.
Welcome back. I think we all realize the role that the eyes play in our daily lives. Thus, it's important to do the things we need to do to protect the eyes and respond to any problems that may arise. We talked with the team at Retina Associates of Kentucky and their patient, Melinda McMurray, about what you need to do and the tools that help you keep a clear focus. At Retina Associates of Kentucky, the eyes clearly have it. This office is abuzz with activity of the patients that need expertise and the skills of retina specialists. It is quickly apparent that this is much more than the corner glasses shop. The eyes are often referred to as the window to the soul, but they are also our window to the world and may in fact be a window to much more of what's going on inside our body. I talked with Dr. Thomas Stone about the eyes and what he sees as the goals, mistakes, and some of the other things that can be diagnosed or noted in the eyes.
You know, just like anything else in medicine, if you catch something early and treat it, a lot of times we can preserve the function. In other words, we can keep people seeing, and the other thing is we can sometimes reverse damage that occurs. Sometimes if we catch things too late, there's nothing we can do. So that's one reason. The other is, you know, the sight is so critical to everything we do. A third of our brain is dedicated towards seeing. So you know how important that is. It's most of our brain is working on what you're seeing. And just think about all the things we can and can't do depending on whether or not we have vision. Writing, driving, remaining independent is a big deal. You can be independent when you can't see very well, but it's a whole lot easier when you can. You know, a lot of people don't see an eye doctor because they think they can see okay. So one thing that really doesn't get to me, but is very common, is a lot of people need glasses and they never know it. This can even happen in high school athletes, people who you think would really need to use their eyes well in order to function well. But a lot of people need glasses and never get those glasses. The other thing is not getting their eyes checked from time to time. I get people who come in and haven't seen an eye doctor for 20 or 30 years. There are conditions that need to be assessed or at least looked at or checked every few years just to make sure everything's going okay. Things like glaucoma fall into that category.
He also notes that regular eye exams are key to your long-term ocular health.
You know, getting regular eye exams is a good idea. You know, I guess the way I think about it is getting a general medical health checkup is a good idea. You know, up until the age of 40, you know, most people only need them every 5 years or so, which sounds like infrequently, but like I said, people come in, you know, oh, you haven't seen an eye doctor in 20 or 30 years. You know, we have specific guidelines for kids that they should be checked, at least screened for eye conditions up until they hit kindergarten. And then between the ages of, you know, 5 and 40, especially when kids are in high school, is when the time they might need glasses and they might have trouble seeing the board. And then after 40, about every 5 years or so. And then once you hit about 55 or 60, probably every couple of years.
Regular eye exams are important, but injuries and symptoms can happen. Dr. Stone highlights some of the times when you need to seek immediate attention.
Certainly anything where one eye or both eyes lose vision, where it's just not just a little blurry, but a sustained loss of vision, whether it's painful or painless, that requires immediate attention. Certainly significant injury to the eye. And that's one thing that we see fairly often. People who have healthy eyes do take them for granted. And we see people every day who are mowing their yard or doing yard work, and they get something in their eye, and you can lose vision permanently from that. So good safety glasses for either work in your yard or work in your garage or hammering nails is critical for preserving vision.
One such case in which a patient developed symptoms and got it checked out was Melinda McMurray. She's in the office at Retina Associates to follow up with Dr. John Kitchens, who has been part of a team taking care of Miss McMurray. He fills us in on her history.
Melinda has had inflammation in the back of her eyes that's resulted in swelling in the area in the very back of the eye, the macula, which is a part of the retina that's responsible for her center vision. And we've been treating this with steroids, which is the best way to take care of this swelling when it's due to inflammation. And unfortunately, she developed one of the side effects related to the steroid treatments, which is high pressure in the eyes and cataracts in the eyes.
Treatments aren't always smooth sailing. We like to think that if we have a problem, we can take a pill or treatment that will immediately fix it. In Miss McMurray's case, the problems have been complex with treatments, complications, and ongoing care that has required a team approach to her care.
I think it's important to be aware that we have great treatments for a variety of different eye conditions, especially even rare conditions like Melinda's rare inflammation and swelling, but that sometimes those treatments have potential side effects.
The important thing was that Melinda recognized that something was wrong early and took the steps to get the care she needed.
Initially, it was blurred vision. Well, it's a couple of things. It was blurred vision and sort of lightning, like sparks in my eyes. We'd just come home from vacation. It was night, and I thought there was lightning, and it just turned out it was actually
the situation where the vitreous humor contracts and it pulls on the retina, and in this case it caused inflammation, and that inflammation led to a membrane forming on the back of my eye, and that caused puckering of the eye, and it caused blurred vision. So Dr. Kitchens performed surgery on that eye, and it helped a lot, but then I got a cataract and had to have that removed.
One of the tools that helps manage her case is called OCT. Dr. Kitchens tells us what that means and how that has changed the diagnosis, monitoring, and management of her condition.
So this is a really unique tool that we have in retina and in ophthalmology called an OCT. It stands for optical coherence tomography, and it basically creates a laser-generated cross-section through the retina. And this technique was developed back in the late 90s, early 2000s. We were the first practice in Kentucky to actually have OCT, and the first to have each iteration of the newer models. And what we're able to do in Melinda's case here is show the image from her left eye that we took back in January, where we can see just a little bit of swelling that's present. At that time, her vision was really good, and we decided that this much swelling didn't warrant any kind of aggressive treatment. We were going to keep her on the eye drops. When she switched her eye drops to a different type, we can see now that today's visit we have much more swelling present than what we did previously. But you could diagnose this with very, very careful examination of the retina, usually putting a contact lens on the person's eye to be able to look in and see with high degree of detail. So you can make the diagnosis. The problem is that you would never be able to compare how well they were doing from one visit to the next, because there was just no way to quantify it. And so that's what this has really revolutionized, is not only making the diagnosis, but also determining the response to therapy.
The Retina Associates of Kentucky are working hard to help Miss McMurray protect her vision and maintain a high quality of life. Just like Melinda, you need to heed the warning of your eyes if they arise. But more importantly, get those annual checkups. So hopefully it's clear that you need to make sure that your eyes have the utmost importance and focus when it comes to your daily health. I'm Dr. Ryan Stanton, and this is StantonMD. Melinda has a potentially long road ahead with ongoing care and management, but she has the team assembled to tackle her problem. We'll be back with Retina Associates next month as we talk with a man that is trying to get his vision back after an unfortunate accident. We'll talk with him and follow him through the operating room and see if he can get back some of the vision that he has lost. Coming up, we talk with the director of the CDC about opioid abuse and the steps they are taking to help protect the lives of Americans. That's next on StantonMD.
With over 40 years of service, Retina Associates of Kentucky provides care for disorders of the retina, macula, and vitreous structures of the eye. Their goal is to provide the best possible care in a compassionate, personalized, and timely manner. This is accomplished through a comprehensive, state-of-the-art mix of diagnostics, medical, and surgical services. They have 10 offices throughout the Bluegrass. Visit retinaky.com. Do you own or work for a business that advances health and safety of the public or its employees? Then you may be interested in becoming a sponsor of StantonMD. There are various opportunities for sponsorship, from the show to the website, social media, print, or a combination. For more information on becoming part of StantonMD, contact Jen at info@stantonmd.com. That's info@stantonmd.com. Now, back to the show.
Abuse has taken over the country. Over 18,000 people are dying every single year, more than road traffic accidents, one of the worst drug abuse issues that we've seen in years. Today I'm joined by Dr. Frieden, Director of the CDC, who's going to help answer some questions about a new set of recommendations released from the CDC on opioid prescription guidelines. Dr. Frieden, thank you for joining me. And why now? Why is the CDC releasing in 2016 new guidelines for the prescription of opioids?
I became CDC Director in 2009, and in 2010 began looking at all of the national data and seeing what a horrific problem this is all across the country, urban and rural, all age groups, all race, ethnicities. And since that time, we've been moving forward with what we can do to support patients, physicians, states, communities to reverse this terrible epidemic. We heard from doctors that it was really important to have guidelines issued by a group that has no conflicts of interests and only the best interests of patients in mind, and that's what we've done.
And where does this current epidemic sit with some of the other prescription or street-related drug issues that we've seen in the past? Is this new or different? Are we seeing more people involved?
This is, I think, unprecedented. What we've seen over the past 15 years is a quadrupling, fourfold increase in deaths from opioids. And now we're seeing kind of a blurring of the lines between prescription opiates and heroin and illicitly produced fentanyl.
Now you have 12 steps here, or 12 recommendations, and they seem to be focused towards primary care. Why is primary care the focus for these recommendations?
Primary care providers write about half of all prescriptions for opioids. So that's one area where we really wanted to focus. But we know that this is something that all members of society have to deal with: patients, families, doctors, and all specialties.
Now, in any way, does this restrict access to prescription medications, the opioids, for anybody who may need them?
Absolutely not. In fact, if you look at the guidelines, we fundamentally say three things. First, for someone who's not on an opioid, they should not be first line. Opioids are dangerous medications. They're addictive and they're potentially deadly. So they should be used really when other things are not going to work. Second, if you do prescribe an opioid, start low and go slow. Smaller doses are very important because higher doses are associated with overdose and death. And third, if you are providing opioid prescriptions, do it in ways that reduce the risk of overdose and death. So we're providing guidelines not just to reduce utilization, but to make utilization safer among those people who do require opioids.
Now, how did we go from opioid prescriptions being something that was used for cancer-related pain and in the acute inpatient setting for people in surgery to now using that as one of the front lines for acute pain? How did we make that transition to what we've ended up with today?
The pendulum has swung back and forth several times. When I was in medical school, there was a lack of recognition of how addictive these opiates are. A generation earlier, they'd been very widely used, and then people basically didn't provide them for severe pain. We need to get the relationship right. Relieving a patient's pain if someone's in excruciating pain is one of the most important things a doctor can do. But understanding that for chronic long-term pain, for back pain or headaches or other conditions, these medications may well do more harm than good.
Well, where do we go from here when it comes to the treatment of pain? Because I see that pendulum now starting to swing back the other direction. Where do we go with the treatment of acute pain and chronic pain in the United States?
Well, for acute pain, one thing that's very important to understand is avoid opiates if you can. If you can't avoid opiates, then 3 days should be enough in most cases, and rarely will it be needed more than 7 days. For chronic pain, I think we really have to look at a comprehensive approach of all the medications and the non-medication treatments that are available. That means things like Tylenol and ibuprofen. These can be very effective. Many people who have chronic pain can have it adequately controlled, and they can function better with those medications. In addition, there's physical therapy, there are injections of steroids or other medications, there are a number of exercise therapies, even some recent evidence that's quite strong that suggests that mindfulness exercises can make a difference. Pain is a terrible thing to experience, and to address it, we need to recognize that relieving it is a long-term issue for chronic pain. For chronic pain, you want to be able to improve someone's both functioning and pain level, and talk with them about what is it that you want to be able to do, and let's work toward that.
And I know you guys have a lot of information. Where can our viewers and where can providers get more information about these guidelines that you just recently released?
CDC.gov. If you go onto our website, we have lots of information for patients and providers. And you know, before we end, I want to really salute Congressman Hal Rogers. He has been sounding the alarm on this for more than a decade. The organization that he started, Unite, is now the national leader in drawing people together, and we're honored to host a summit next week on this topic. And Congressman Rogers is responsible for a lot of the progress that we've made, and it's because of his support that we're able to provide support to every state in the country to help reverse this terrible epidemic.
Hal Rogers from right here in Kentucky. Thank you, Dr. Frieden. Thank you for your time. We appreciate it, and thank you for your efforts for helping with this opioid crisis as one provider to another. We very much appreciate the guidance.
Thank you, and thank you for what you're doing to expand information and knowledge about this so that we can get to a better place in how we manage pain.
Once again, if you want more information, that's cdc.gov. They do have great information for the practitioner, patients, families. There's a lot of resources out there. You need to dig in there and make sure that you're educated, because it does affect everybody, every socioeconomic status, every race. Everybody out there needs to make sure that they're aware of what's going on. I'm Dr. Ryan Stanton, and this is StantonMD. It's time now for 5 tips for healthier living. Since we've been talking about the CDC opioid prescribing recommendations, let's highlight some of the things you can do to decrease your risk of addiction and abuse of prescription pain medicines. First, use them only when absolutely necessary and for as short a time as possible. This is key to preventing addiction. Sometimes they're important to be used for acute painful situations, but you want to make sure that you're only using them as directed and for that purpose. Second, use the lowest dose possible in short-acting formulations. We want to make sure that the medicines we're using are specifically designed for that illness and only used for that illness, and the longer-acting ones are not good for acute pain. Third, use non-opioid options. These may include things like Tylenol, ibuprofen, other NSAIDs, as well as other things such as meditation and physical therapy that may help with your pain but don't expose you to the risks of addiction associated with opioid pain medications. Fourth, chronic pain, you need a multidisciplinary pain specialist. This is key. The best way to prevent addiction is to have a team there available, making sure that they use all the tools they can use to make sure that you're safe and healthy, and also monitoring for the risk factors and things that may put you at higher risk for addiction. And finally, if you have addiction, get help. The key is recognizing that you have a problem and getting the resources available that you need to do to make sure that you can get better and get through your addiction. It can happen. It's possible. Recovery is the key. The key here is that opioids are an important medication for acute severe pain and may have some role in chronic pain in certain cases under the close watch of a pain specialist. But we have learned over the last several years that there's a significant and real risk of addiction, and we must do everything we can do to prevent further opioid-related deaths. That's all the time we have for this week. I hope you will join us next time as we'll talk about dental reconstruction, regaining lost vision, and we'll sit down with somebody who lived through an opioid addiction and is now helping others with the problem. That's all coming up next month. Until then, I'm Dr. Ryan Stanton, and this has been StantonMD.